Hi everyone, welcome to Rooted Provider. This is a series that is very similar to what used to be called Talk After the Tea. It is based on topics that are geared towards service providers in the healthcare field. Now, what we will cover in this series is more of the behind the scenes of practice. What are ways that we can get our mindset, our systems, and our ways of practicing to a more efficient, a more aligned place so that what we are providing and what is client facing is even more impactful and aligned with what we want to be providing as therapists or doctors or social workers, whoever you might be and whatever hat you wear in the healthcare field. I want your practice to be aligned with who you are, what you value, and that is how you're going to show up with your clientele. So again, welcome to our new series called Rooted Practitioner. What is it called? Rooted Provider. Okay, so let's just dive in. I am going to talk today a little bit about, who am I kidding? I'm going to talk a lot about translating data from our evaluations into care. And in the past, I'm trying something new. I'll be totally candid with you guys. My previous episodes have been very scripted, and I've done that in a way it just doesn't feel as aligned, and I just like to talk a lot and kind of just let the ideas flow, and so that's what I'm trying with this episode. So good luck. Maybe you need to watch it on 1.2 speed. I don't know. We'll see how chit-chatty I get. But today I want us to talk about and think about how we are translating the data and the information in our evaluation reports into how care looks like for our clients or our patients or their families. Why is that important? Because I just found when I hand a family a 10 to 20 page report with all the information that the insurance company needs or the next provider needs, the things that are evidence-based, the information that we all need as providers to make the care as seamless as possible. When I hand that report to caregivers and families, it can feel daunting and overwhelming, and I can probably count on, my fingers how many of my families actually read it, from top of page to end of page, without feeling like they probably zoned out a few times in between. And so the way I would kind of help ameliorate, I don't know if that's the word right, but the way that I would kind of work that process a little better is to make sure I was talking through the report. But even then, it felt like I was just verbally spewing all this information, and it was kind of just sort of landing in some places, and other places I was just overwhelming the family in a different way. And so we're going to just talk a little bit about what that burden can look like, and let's just dive into how we can change that process to make it a little more accessible for our clients and their families. So we write long reports for compliance, but they rarely initiate that daily action or facilitate that daily action. And so when we hand over that long report, are we really giving our patients and their families a roadmap to what their treatment is going to look like, or is it kind of more of a textbook? So when we hand it off to another discipline, obviously a lot of that information is important that they want to hear. How many disciplines actually have the time to go through that report word for word and then take it and interpret it, or listen to or understand how that is going to impact their, your shared patient and their care? So are we giving them a patient? Are we handing off a patient, or are we handing them a pile of data? So streamlining your practice isn't necessarily about doing less work, but it is about making the work you do and the processes in that work a lot more accessible to the people that you're going to work with, the team that is working with your patient or your client, and what is going to come out on the other side of it. So let's think about components of what we could add to an at-a-glance template or an at-a-glance sheet that summarizes, it's not a summary of our evaluation report, because our evaluation report should have a summary at the very end, right? We all know that, best practice, have that summary at the end. That is ultimately probably what a lot of providers go to. That's what probably a lot of the parents go to, but that stuff in the middle is also important. And there's just things we want to make sure that we point out so that we are leading with a client-centered approach. Okay, so there are 4 components of the summary, this at-a-glance summary, that I felt would be helpful to include, as it's almost like a cover page for your report, and it is a way for someone to take your evaluation and then digest it a little bit easier. And again, this isn't just for pediatrics, that is my field, but it could be something that could be applied to neuro rehab, geriatrics, or mental health practices alike. So let's start with strengths, the individual strengths and assets. So what is the patient or client bringing to the table, and start here to set the tone for the entire treatment team. We want to start with their strengths, because then that helps us understand what we can build on and how we can best support this client from here on out. Are they visual learners? Do they do best when they have a team around them, or do they do best in a one-on-one situation? What are their strengths, and how can we leverage those to make the most progress in the treatment that's upcoming? Next up, what are the current needs to support their participation either in their own treatment or just in daily life? Now, this is a very OT mindset to come in with, but it's something that we can all providers can focus on. So what are the needs that our client has? So what environment or sensory supports can we set up for our upcoming sessions or appointments that will allow our client to be able to participate the most fully that they can? Are they going to do better off with a virtual platform like this? Are they going to have better success with not only hearing the information, but also reading it? Are they going to have better success if there are family members present or if they're by themselves? Things that they need to support that participation. Up next on this cover sheet, this one sheet, this at-a-glance sheet, top 3 functional goals. Now, it doesn't have to have every single goal. I've seen clients with many goals and clients with only a couple. So let's think about what are the top 3 functional goals from your perspective as a provider, and potentially what you've gleaned from the family or the client during your evaluation. And we want to make sure these are written in plain language and tied to function. How is this goal of increased motor stability going to impact their daily life? And this is a way to make sure there is better understanding on the client and family side, and better understanding of what is their priorities from the rest of the treatment team. So if a colleague or a caregiver reads these, they should immediately know what success is going to look like for the client in the future. And then finally, the 4th aspect of this at-a-glance sheet that I think should be included is, what does the path forward look like? What are the very next few steps that need to occur in order to make progress on these goals? Is it engaging in therapy, whether that be with the person who did the evaluation or with another provider? And what is the recommended frequency of that therapy that we feel is going to make the biggest impact right away? Is it setting up another follow-up appointment with a specialist or another provider? What does that next step look like that's going to get your clients' needs met and move the needle as far as their goals go? Let's make that really clear, because I think in the past I've heard stories of clients who get diagnoses or are told, like, well, go see a psychologist. And honestly, they leave without really fully understanding what the actual next step is. Like, I can say, like, yeah, go see a psychologist, but who do I see? Who do I look for? What is the best psychologist for my diagnosis? Or if they just received a diagnosis, obviously they're going to feel pretty overwhelmed with what that diagnosis means for their life moving forward. So we want to include some very actionable next steps in this treatment at a glance. Now, Practically speaking, I also feel that I don't want to be adding things to the list of what we have to do as providers because we already are on a limited amount of time. However, once you set this system up for creating it, it can start to become a little bit more automatic. It can even be something that you do as you're building that evaluation report. You just copy and paste over into this thing, and then you can work on it. You can work on editing and making it a little bit more into plain language by, at the end of your report time. So what the goal of this ultimately is not only to make the seamless transition between, or the seamless connection between providers on one client's care team, but also to increase the buy-in from the patients and clients that we are working with, to just make it a lot more clear about what the goals are from what the data is that we took as providers, and now how are we tying that into function, and how are we tying that into the priorities that the client gave us in that initial evaluation. And it gives it to us in a quick snapshot. And that is how people are going to want to take in information versus reading a textbook about the data and what percentage or what percentile they might be scoring at, because that can start to weigh on them, or that can be really confusing, and it can just make the whole process even more overwhelming. So let's think about next steps. If you're like, yeah, that actually sounds like a great idea, love to do it, sounds a little bit like it's putting more work on me as the provider, but what I challenge you to do is just start with one eval report, whether that be one that you've already written in the past and you're still working with that family, or do it for your next evaluation. And then on top of that, talk to your colleagues. Are there other providers in your department or in your network that think that something like this could also benefit them and their clients? And is there a way that we can start to build something together, a more systematic way to do this, whether that be in the EMR system or build a template in the computer system that we are already working in, to make this even more easily integrated into our practices. And we want to make sure that, the benefit is clear for us as providers, that when the patient and caregiver sees this, they don't just see a schedule of therapy appointments, they see the partnership and the teamwork and the collaboration that you want to have as a provider. So I am challenging you, after your next evaluation, or even for an evaluation you've already completed, take 5 minutes only. Set a timer. See if you can hit on those 4 key areas: strengths, needs, goals, and next steps, and get it onto one sheet of paper, and not no more than one sheet. I promise we only want to keep it to one sheet, and give that to the patient or caregiver before they leave at their next appointment. And don't wait for the formal report to be fully processed even. If you already got an idea in mind of what the goals are, what the strengths are before they walk out the door, build that one sheet together. And then you can take the time to refine it afterwards and send them on their way. Making sure our clients understand that we recognize their strengths, that they understand what their goals are going to be and how those goals tie into their daily function, is going to make this partnership between provider and client even more strong and effective in the long-term treatment process. And again, this is a sheet that maybe we update every couple of months, every 8 weeks, whatever that treatment frequency looks like and makes sense for you. And from there, we can just make sure that the communication and our clients are feeling supported. And we, as providers, know that we are translating the information clearly and effectively for our patients as well as for our colleagues to have the best impact on our clients' goals. I appreciate you so much for joining me today in this topic and in our new, quote unquote, new series, The Rooted Provider. And I look forward to connecting even more in the future and just providing more videos like this and resources like this for you to be and feel supported in your practice. And as part of this week's video, I am sharing a template that you can use to either build your own or just start using it with these 4 pillars of information that can go on your At-A-Glance sheet. So if you click on the link below, I'll be sharing this sheet and a way to access your own template for this evaluation at a glance. So just like I say in this At-A-Glance sheet, we have next steps. And what I want you to do is take the time to download that template, take some time to reflect on how this could look in your practice to improve the communication between you and your clients and you and your colleagues. And then take a moment to just let me know what it looks like for you. Is this something that you're like, I don't think this could ever work for us, but I get the value in it. How do I apply that to my practice? Or if it's something that you integrate and you're like, wow, this was amazing, I want to hear about it. Shoot me a message, send me a DM, shoot me any sort of other way to connect that might be out there. I don't know. But anyway, I'm looking forward to connecting with you and supporting you in your practice. And I will see you next time on The Rooted Provider.